Okay, so welcome to part 2. So this is now moving on to the grading. Okay, so we just looked at the stage, and we've got the stages of 1, 2, 3, 4, early, moderate, severe, or very severe. Now we need to grade it. Okay, so we need to capture the progression of the disease, and this is done at the time of diagnosis. Okay, now the way that they do this, so you can see here that we're either looking at a grade A, which is slow, B moderate, or C rapid. And the way this is worked out is it is actually taken as the percentage of bone loss divided by the person's age. Okay. So for example, if we had 30% bone loss in a 60-year-old, that would give us the answer of 0.5. Okay. And what they've done is they've worked out a system where if we have less than 0.5, it would be a grade A. If we have 0.5 to 1, it would be a grade B moderate. And anything above 1 would be rapid. So therefore, with this patient, your 6-year-old patient that has 30% bone loss, 0.5 will go into probably the most common category that we're going to have will be a grade B, and it's a moderate. Okay, let's use another example. Okay, so using the same principle. Okay, so this time we're going to have a smaller pen to start with. We're going to have 50% bone loss in a 40-year-old. 50% bone loss in a 40-year-old. So 50 divided by 40 equals 1.25. Therefore, for this grading, this would be a greater than 1, therefore it's rapid. Okay, so rapid bone loss. Okay, so there's a little equation there that you can do. I'm not sure what that came up. I don't want that. Okay, so there's a little equation you can do, and effectively, if you look at this, you can work out these things fairly quickly, depending on the equation. So for example, say we have 30% bone loss in our 60-year-old. This equaled 0.5. Okay, so that's effectively half. Okay, half of the age is 0.5. Okay, but let's say we have a 25-year-old, so it's less than the number above. Okay, still the same amount of bone loss, it's 30% bone loss, but because of the age, okay, this has now gone up to 1.2, which has gone into rapid. So the 25-year-old is less than the amount of bone above, so therefore you know that it's going to go into that more than once, so it's going to go into that rapid section. If you get stuck with that, just go back to the basics of percentage bone loss divided by the age. Just as a reminder, that percentage of bone loss comes from that worst affected tooth. So you're still looking at the tooth. Okay, so this was the tooth that we looked at as an example for our staging. Okay, so on this case, we worked out our staging. I'm just going to get rid of this. Okay, so we're still going to use this tooth for our bone loss. And in this case, we determined our bone loss. If we look approximately, we're going to say this is 50% bone loss. Whoops. Okay, there's 50% bone loss there. That would be 75% bone loss. Okay, so if we look at this area here, let's do that one. So we're looking here at this amount of bone loss. And I'm going for this interproximal area here. I'm going to say there's 25% bone loss. Okay, 25% bone loss. So for this particular tooth, or this particular patient, we'd already worked out it was moderate and it was at stage 2. So the staging was at 2. So for bone loss, this is a 46-year-old patient. Okay, so the amount of bone loss for that affected tooth is 25 over 46. And it actually is just above, so it's going to be 0.6, which would put us into which category? Okay, it would put us into, I'll go to the next page so we can look, remember 0.6, let's pull that down. Okay, so we are actually 0.6 would be in here, so that patient would be B moderate. Okay, so we already worked out that they're a stage 2 and now they're a grade B. Okay, so they're stage 2 and grade B. So they're stage 2 and grade B. Stage 2 meaning that the worst affected tooth, that the interproximal area of the bone goes into that coronal third of the root, and the grade B is there is approximately 25% bone loss, and 25% divided by the patient's age at 46 gives us 0.6, which classifies us into a grade B. And both of these would be considered moderate. Okay, stage is moderate, grade is moderate. So what else do we have to work out? Okay, so the next thing we're looking at is the extent of the disease. Okay, so you're looking now at the overall of how many teeth are affected. So when it comes to the extent, we've got three ways of categorizing it. Is there a molar incisor pattern? Is it localized, which means up to 30% of the teeth are affected? Or is it generalized, which means more than 30% of the teeth are affected? So again, is it molar incisor, a molar incisor pattern? Is it localized, where up to 30% of the teeth are affected? or is there more than 30% of the teeth affected, which means it's generalised. Well, if we go back to our female patient, a 46-year-old female patient, she actually just had one area that was affected, which you saw in the radiograph. Okay, so there was one area, so she was actually less than 30% of her teeth was affected, so therefore she had a localized, okay, so it was localized. So going back to our patient, remember we said that they were at a stage 2, okay, where the interproximal bone loss went into the coronal area of the root. They were a grade B, which means they had the progression was moderate for their grading, because their percentage bone loss, which was 25% for that worst effective tooth, divided by 46, their age, gave them 0.6, which put them into that grade B category of moderate progression. And now, as we've seen, or as I've said, there was less than 30% affected, percentage of teeth overall affected. It was just a localized area. So they had, the extent is it was localized. Okay, so we're building up a picture, the stage, the grade, the extent. Now we need to move on to, okay, so this part here is about once a periodontal patient, always a periodontal patient. And depending on where you pick them up will depend on, you know, how you've graded them so far. So one thing that comes into that is we need to know about the stability of their disease and the current status of the disease. So when we're looking at this current status, okay, we need to know, are they stable, are they in remission, or are they unstable? And for this, we use bleeding on probing. Okay, so if our patient is stable, bleeding on probing is less than 10%. Okay, less than 10%. All right. If our bleeding on probing is in fact more than 10%, and we have periodontal pocket depths of less than or equal to 4 millimeters, sorry, okay, so we've got greater than 10% bleeding and probing, we've got pocket depths of equal to or less than 4 millimeters, and there is no bleeding on probing at the 4 millimeter sites. Okay. Then disease is in remission. Okay. So overall, less than 10% bleeding on probing, everything's stable. If there's more than 10% bleeding on probing, and there is periodontal pockets of less than or equal to 4 millimeters, and there's no bleeding on probing at those 4 millimeter sites, it is in remission. If we have periodontal pocket depths of greater or equal to 5 millimeters, or bleeding on probing at 4 millimeter sites, it is unstable. Okay, let's just talk through this again. Okay, so we're looking to see the status of the disease. Are we stable? Is it in remission, or is it unstable? So if we look at stable, there is less than 10% bleeding on probing. Okay. If we look at the disease in the state of remission, there is greater than 10% bleeding on probing, with periodontal pocket depths of equal to or less than 4 millimeters, and there is no bleeding on probing at those 4 millimeter sites. Okay, then we are in remission. And unstable is periodontal pocket depths of greater than or equal to 5 millimeters, or bleeding on probing at 4 millimeter sites, and then we are unstable. And just to back that up again, I'm just going to use this from the flowchart. That you've got these boxes to show the current status of stable, and you can see bleeding on probing is less than 10%. Periodontal pocket depths are less than or equal to 4 millimeters. There is no bleeding on probing at 4 millimeter sites. Remission, bleeding on probing is greater than or equal to 10%. The pocket depths are less than or equal to 4%, and there is no bleeding on probing at 4 millimeter sites. And are currently unstable, periodontal pocket depths are greater than or equal to 5 millimeters, or periodontal pocket depths are greater than or equal to 4 millimeters and bleeding on probing. Okay, so current stability, periodontal pocket depths at 10%, bleeding on probing is less than 10%, periodontal pocket depths are less than or equal to 4 millimeters, bleeding on probing, there's no bleeding on probing at 4 millimeter sites. In remission, bleeding on probing is greater than or equal to 10%. Periodontal pocket depths are less than or equal to 4%. There's no periodontal bleeding on probing at 4 millimeter sites. And currently unstable is periodontal pocket depths are greater than or equal to 5%, or periodontal pocket depths are greater than and equal to 4 millimeters, and there is bleeding on probing. So the other thing that needs to be taken into account is risk factors involved. And for most of you, you would recognise, for example, risk factors of things like smoking, diabetes. Those, I would say, are the two significant ones for periodontal disease, and these things, or any risk factors that affect the state of periodontal disease should be taken into account. So what we have Let me finish. Okay, so just to finish off with, I'm going to do a couple of, as it was, case studies to give you an outline. So for the first patient, it's a 45-year-old female. Okay, and what we're looking to do, remember, we're looking at the this is about staging and grading. So we're looking to create that statement. So we're gonna find out the stage. Okay, then we're going to look at the extent of the disease. Then we're going to look at the grade. And then we're going to consider any risk factors. And this will give us a diagnostic statement. Risk factors. Put that down there. Okay. So let's go to the first part about the stage. Now, in this situation, we have had full mouth periatricals. We have a patient who is a 46-year-old female. Okay. And effectively, we have done a full periodontal charting, and they originally came in with a with a BPE of 2, 2, 3, 3, 3, 3. So that was their periodontal charting when they came in. They've had initial therapy, okay, and I'm just going to use this as the most affected area to have a look at how we're going to grade them. Okay, so let's have a look at the stage to start with. All right, so the stage here is, remember, we're going to the most affected tooth, so I'm going to use this tooth here. Okay, we're also looking for the staging, remember, at bone loss at interproximal sites. Okay, that's just where we're looking, interproximal sites. So from that, I'm going to use this area here, and now I need to work out at what stage it's at. So if I put where my bone level maybe should be, and the first third of the root, the coronal third, the mid third, and that's the apex. Okay, so this is my coronal third, this is my mid third, and this is the apex third or apical third. And for me, I can see that this bone level is affected in down to here, which means it's in the coronal third, which means it is at a stage 2. Okay, it's at stage 2. So stage 2 to start with, which is going to be a moderate, okay, which is equivalent to moderate. So it's stage 2, moderate. So let's get rid of this to move on to the next bit. Now we're looking at the extent of the disease. Okay, so when this patient came in, they've had initial therapy, and actually the only area that's remaining now after initial therapy is this one area here. Everything else is resolved to effectively code 2s. So because of that, we're looking at one affected area. Therefore, it's less than 30% of the teeth in the whole mouth are affected. It's not a molar incisor pattern, so therefore it's localized. Okay, so the extent is localized. Okay, because it is less than 30% of the teeth affected. Okay, stage 2, localized. Now we need to grade it. Okay, grade it. So to grade it, we take this most affected tooth, and now we need to work out the percentage of bone loss. So if I was looking at this tooth, we're going to say that is approximately the bone level. We'll take this as 50%, and that would be 100% down there. So if I look at this area here, I'm going to say there's 25% bone loss. Okay, so for our grade, what we do is we take our bone loss, let me just move that over in case I've run out of, okay, we're going to take our bone loss there. So we're going to take our percentage bone loss, divide it by our age, which is 46. Okay, 25% bone loss. Okay. So 25% bone loss divided by 46 equals 0.6. That brings us into the grade B category, which is moderate. Okay, grade B. If it was less than 0.5, it would be an A, which would be mild. Between 0.5 and 1 is moderate, which is a grade B. And anything above 1 in that equation would give you rapid. Okay, rapid. Okay. So we also look at any risk factors. Now this lady didn't have any risk factors, so I'm going to say there are none detected, because at the time of diagnosis there was nothing detected. But it doesn't necessarily mean when you get a patient in that they would always know what was going on. Maybe a undiagnosed diabetic and so on. So just to bear that in mind. The current status of the disease. You would look at the periodontal charting for this and the bleeding on probing. At this stage, the patient has less than 10% bleeding in the whole mouth. Okay, so there's less than 10% bleeding, therefore it is stable. Okay. Okay, so hopefully that would explain the whole statement. So going through it, we have a 46-year-old female who's at stage 2 periodontitis, which is localized, grade B, and has no detectable risk factors and is at present stable. That would be our diagnostic statement for this. Let's have a look at another one. So here we're going to use this OPG. This time we have a 50-year-old male smoker. Firstly, we're going to look at the stage. Remember, the stage is looking at the most affected tooth in the dentition. And for this, on this occasion, I'm going to use, I'm going to use this tooth up here. If I can, I'm going to try and zoom in a bit. Can I make that bigger? Let's have a look. Okay, so this is our most affected tooth I'm going to use. Okay, so the first thing to do is we need to look at the amount of bone loss for that affected tooth. And for me, the bone level up here is around about this area here. It's right on the apex of the tooth. So for me, that would be in the apical third of bone loss. Therefore, we are at stage 4. Okay, stage 4, which is very severe. Okay. And here we're looking at the potential that the whole dentition could be lost, right? Potential for the whole dentition could be lost. So the next thing we're going to do is we're going to look at the extent. And if we look, we're looking at, is there more or less than 30% of the teeth affected? And I think you can see that there are definitely more than 30% affected. Therefore, this is generalized. Grade. So this is the patient's age. So we'll just go over here. So our patient is 50 years old. I would say the amount of bone loss on that molar, I'm going to say, is 80% bone loss on the most affected tooth. So if we look at this equation here, we're looking at 80 divided by 50. This equals 1.6, which would fit into the category of rapid, or C, A, B, C. So that's grade C. So the progression is rapid. Okay. Risk factors involved. Smoking. Current status. I'll be using a periodontal chart and determining bleeding on probing and pocket depths. And in this case, we had periodontal pocket depths of greater than 5 millimeters, which is effectively this patient is unstable. Okay, periodontal pocket depths of greater than 5 millimeters, which were also bleeding, but regardless, if it was greater than 5 millimeters, so this patient is unstable. So a 50-year-old male patient who's at stage 4, periodontitis, which is generalized, grade C, unstable condition with risk factors of smoking. And that is effectively grading and staging of periodontal disease. Other things that can come into the radiographs, for example, if historically you've got evidence to say there's been tooth loss and there's evidence, for example, a radiograph to say there was a tooth lost, let's say here, that you've got a radiograph here, the tooth is lost, and therefore you can use that as evidence for the grading and staging. So just to bear that in mind if there's been tooth loss and you have evidence to support that. So, but I would refer to the BSB Perio and the webinars they've done, and that is the main places where you'll find most of your information.